My name is Fechip Kemoy, a nursing student, and this is my intramuscular and subcutaneous injection validation. So to familiarize with my patient is Sam Johnson, date of birth 18XX, allergies none, he's on full cord and is a high fall risk. Sam Johnson was admitted at the medical surgical unit and is being managed for dehydration and falls after being found by the son at home. Past medical history is hypertension and asthma. He's on furosemide 20 mg per oral daily, albuterol inhaler 2 puffs as needed for shortness of breath. He also has acetaminophen 500 milligrams as needed for pain. He has 2 children and he lives alone. His weight is 145 lbs, height is 5 feet 4 inches. Vital signs are within normal limit except for the blood pressure, which is 128 out of 72, slightly elevated, and temperature, which is also slightly elevated at 27.6 degrees Celsius. General appearance is alert and oriented, resting in bed. Cardiovascular, sinus rhythm, no chest pain noted. Respiratory breath sounds are clear and labored breathing. For the GI, there is normal bowel sounds. GU, he voided 100 ml per hour, clear amber urine with assistance to the bathroom. Extremities are pink and warm, and there is equal movement in all 4 extremities. The skin is pink, warm, and dry. Neurological is alert and oriented to place, person, and time. Pupils are equal, round, and reactive to light and accommodation. No neurological deficits. IV in right arm. Labs are to be drawn. Lab team is already notified on the way. He's a high fall risk. He has some soreness from falling, but there are no broken bones. The provider ordered that the patient to be managed for dehydration and falls. He's on regular diet, up with assistance. Vital signs to be done for hourly. We should notify the provider in case of any acute changes. The patient is on IV fluid, normal saline, 100 milliliters per hour for 2 liters. The labs are to be done, and lab team has been notified. At the MAR, he has been prescribed Fluzone 0.5 ml intramuscular injection. The patient doesn't know when he got his last shot, so this is due now. Heparin is also on heparin 5,000 units per 1 meal, subcutaneous daily, and the last time it was administered is yesterday. It's due now. It's also on furosemide 20 milligrams tablet, oral dose 20 per oral, once daily. Last administered at 7:30. The next one is due tomorrow. Albuterol inhaler 2 puffs quarter 4 hourly as needed for shortness of breath. Acetaminophen 500 mg dose, oral 2 tabs every 6 hours as needed for pain. Last administration is unknown. Next is due as needed. So first I'm going to perform my first med check. So my first medication is Fluzone, and the patient is prescribed 0.5 intramuscular injection for Sam Johnson, date of birth 18XX. So this vial is 5 ml, so it means I'm going to draw 0.5 ml of this. So the medication is meant to prevent to build immunity for flu infections, and he doesn't know the last time he got it, but it's given 2 to 3 years. So he's due for the next injection right now. I'll document once I've given it. So for the second medication, this is heparin for Sam Johnson, date of birth 18XX, and he's to be given 5,000 units per 1 ml, and this is 50,000 units per 10 ml. So it means I have to draw 1 ml, so that for the 5,000 units. This is indicated to prevent blood clotting because our patient is confined to bed right now, and it's given subcutaneously daily, once daily. And the last administration was yesterday, and it's due right now. So I'm gonna perform my hand hygiene. Put on my gloves, so that I can prep the medication. So I'm going to prep my first medication, which is Fluzol 0.5 ml intramuscular injection. I'm going to prepare my med as I do my second medication check. So this is Fluzon 0.5 ml intramuscular injection for Sam Johnson 18XX. So this is Fluzon. This is a 5 ml vial, so I'm going to draw 0.5 from this, and it is given IM, and it should be given 2 to 3 years, but our patient doesn't know the last time he received it, and it's due right now. It's indicated for preventing flu infection. So right now I'm going to prep this medication. So to prep it, I'm going to use my 1 ml syringe. So I'm gonna open it, and then I'm gonna use the blunt needle to draw the medication. So just to confirm, this is Fluzon, and the expiry date, it's still okay, it's not expired, and as you can see, it's clear, not cloudy. So I'm gonna clean for 15 seconds, and then I'm gonna, because we're giving 0.5, I'm gonna pull 0.5 air, and then I'll push it to the vial, and then I'll draw the 0.5. Just to make sure there's no air coming in with it, I'm gonna be pushing back and just confirming. All right, that's 0.5. Okay. Oops, sorry about that. 0.5. So, God, did I drop? I dropped the cup. So I dropped the cup, but ideally I'll do one hand cupping, and then take this off. It's gonna be so hard to take it off. And then I'm going to put my 25 gauge 1 inch needle. So I'm going to document to label my medication so that I don't get confused while giving. So this is Fluzon 0.5 ml to be given IM. I'm gonna make sure I put this together. I'm gonna put that aside. So again, I'm going to perform my second med check for my heparin and prep it. So this is heparin for Sam Johnson, date of birth 18XX. The heparin is to be given 5,000 units per 1 ml, and this comes in 15 units per 10 ml. So it means to draw 50 ml, I'll have to draw 1 ml. I'll have to draw 1 ml for 5,000 units. I'll have to draw 1 ml of the medication. So this is to be given subcutaneously, and it's given once daily. It was last given yesterday and is due now. The indication is prophylaxis for blood clotting. So I'll document after giving. So I'll have to clean. First of all, we have to check like the expiry date. It's not expired. As you can see, the medication is clear and not cloudy. It's okay. So I'll prep my syringe. I'm gonna be using the 3cc syringe, and I'm gonna use my blunt needle to draw the medication. So I'll have to clean my medication. And then trying to get this off. Okay. So I'm gonna make sure, because I'm gonna be giving 1 ml, I'm going to draw 1 ml of air. There we go. And then I'm gonna push the 1 ml of air inside, and then roll it up, and then draw it. So that's 1 ml, just to make sure there's no air there. Try push it and draw it again. All right. So that's 1 ml. So I'm gonna use one hand recapping. And then I'm gonna take this out, and then I'm gonna put this. This is my 1 inch needle, 25 gauge. And then I'm going to also label so that I don't get confused while giving it. Fluzone, heparin, 1 ml. To be given subcutaneous. So yeah, so I performed my first and second med check. So right now I'm gonna put this together and then go introduce myself to the patient. So I'm gonna take off my gloves, wash my hands, and knock.
Yeah, come in.
Hi.
Hi.
My name is Faith Kemoy, and I'm gonna be your nurse for today. I'll give privacy. So, can you please tell me your name and date of birth?
Sam Johnson, 18XX.
All right, let me just check your confirm. Is that okay?
No problem.
All right, so I'm gonna scan just to make sure, all right? How are you doing today?
Pretty good.
Are you in any pain?
No.
All right. So I have your medications here with me right now. These medications are heparin and fluzone. Are you aware that you're prescribed these medications?
Yeah, I think so.
Okay, the fluzone is meant to build immunity against flu infections, and you're supposed to get 2 to 3 yearly, but it's documented that you don't know the last time you received, right?
Yeah.
Okay, so this medication is meant to just build your immunity against flu infections, and the side effects are mainly fever and muscle aches and fatigue. In case you experience these signs and symptoms, please let us know. Is that okay with you?
Right.
Okay, your second medication is heparin, and because right now you're just mostly in your bed, you're prone to get blood clots. This medication is meant to prevent you from getting those blood clots. Is that okay?
Yeah.
So this medication, side effects mainly is you should just watch for bleeding. You should watch for bleeding in your urine, maybe nose bleeding, or bleeding on the IV site. Okay, if you see the bleeding, please let us know. Is that okay with you?
Oh, yeah, that's fine.
Do you have any known drug allergies?
No, none that I know of.
Oh, okay. All right. It's actually documented in your form that you don't have any drug allergy. So I'm just going to prep my medication and then give it to you. Is that okay?
Yeah.
All right. So I'm going to wear my gloves quickly. And then I'm going to now do my third med check against my MAR. So my first medication is Fluzone. I'll scan it. So I'm going to scan this medication. So this is Fluzone for Johnson Sam. Date of birth 18XX. Fluzone 0.5 mils. It should be given intramuscular. This medication is for building like immunity against flu infection, and he doesn't know the last time he got it, but it should be given after every 2 to 3 years. So I'm gonna go ahead and give this injection. I am, and then I'll document. Hey Sam.
Hey.
I'm back.
Right.
So I have your Fluzone injection. I'm gonna give you this injection on your deltoid, but mostly it also can be given on your vastus lateralis or your ventrogluteal muscles. But today I'm gonna give you on your deltoid because this is easily accessible. I don't have to expose you that much, and then this place has a good blood supply, and it's gonna be good for the absorption of the medication. Is that okay with you? All right. So first, I'm gonna clean in and out the injection site. And then I'm gonna use the Z track to like retract the skin and then give it at a 90 degrees angle. Push it out at 90 degrees angle, like, and then the injection site is okay. There's no obvious bleeding. I'm gonna recap this safely. The injection, there's no leakage in the injection site. There's no inflammation. So Sam, I'm gonna stay here with you for 5 minutes to just make sure there's no reaction to this medication given. Is that okay with you?
Yeah, that's fine.
All right. 5 minutes. No allergic reaction. Are you okay, Sam?
Yeah, I'm good.
All right, I'm gonna prep your second medication and give it to you. This is your call late in case you need anything. Is that okay with you?
Sounds good.
All right. So he came back and I document that the medication has been given. So for my second medication, I'm gonna perform my third med check before giving it against the MAR. So I'm gonna scan the medication. Yes, so this is heparin, 1 ml subcutaneous for John Sam. The heparin is given once daily, and the last was given yesterday, so it's due right now. This medication is given subcutaneous, and it's 1 ml. It's indicated for prophylaxis against blood clotting, and this is 1 ml, 5 units of heparin. So right now I'm gonna give, and then I'll document that I've given. All right. So I'm back again.
Okay.
with your other medication. How are you feeling?
Better.
Oh, okay, that's nice. So right now I'm gonna give you your heparin. Do you remember what I told you about heparin?
Yeah, bleeding.
Oh yes. So you have to watch out for bleeding, okay?
Mm-hmm.
All right. So for now, I'll have to give you this heparin, and heparin is given subcutaneous. So I'm gonna give it in your abdomen, but most of the time it can also be given in your anterior thigh and your upper arm. Is that okay with you?
Yeah.
All right. I'm gonna expose your tummy. Is that okay if I go ahead?
Yeah.
All right. Try to make sure I don't expose my patient. All right. I have to inspect your abdomen first, and this medication is given at least 2 inches away from your umbilicus. Is that okay?
Mm-hmm.
So I'm gonna palpate your abdomen. In case of any pain, let me know. Okay?
All right.
Do you feel any pain?
Nope.
All right. On my palpation, there's no there's no tenderness, and there's no like muscles in your abdomen. So I'm going to go ahead and give you the medication. Is that okay?
Yeah.
All right. So I'm going to clean. In and out. So this medication, I'm gonna give it. Sorry. Subcutaneous medication. I'm gonna give it at 45 degrees because of your BMI. If you had a bigger BMI, then we would have given it at an appropriate angle. Okay, so like it can be given 90 degrees with people who have bigger BMIs. Okay, so I'm gonna give it at 45 degrees. Is that fine with you?
Mm-hmm.
Alrighty, so I'm gonna go ahead. All right, I'm gonna pull it out at the 45 degrees angle, and then as I can see, there's no bleed, there's no backdraw of the medication, and the site is okay. It's not inflamed. Okay, I'm gonna cover you back,
Mm-hmm.
and in case of anything, please let me know. I'm going to recap safely my needle.
There are some effects that may occur. There are risks of heart failure, tachycardia, which is just your heart rate being like a little bit low.
I'm gonna
And then
document
pulmonary edema.
given
Okay.
at 7, and then I'm gonna stay here for at least 5 minutes to make sure you have no reaction to the medication. How are you feeling?
Good.
All right, that's nice.
Just a little bit of pain.
Oh, that's
Aside.
expected. It's gonna subside in a few minutes. Is that okay?
Right.
All right. So Sam, I'm gonna go for 15 to 30 minutes. Then I come back and reassess you. Is that okay?
Yeah.
Here is your call light. In case of anything, if you experience any of the side effects I told you, please press the call light. All right.
Okay.
Okay, I'll make sure the bed is locked, there's no tripping hazards, and my patient is comfortable in the bed. So I'll draw away the privacy curtain and then take the half light off and wait. 15 minutes done. Knock knock.
Mm-hmm.
Can I come in?
Yeah.
Okay, provide privacy. Hi. How are you feeling right now?
Yeah, the pain is a little bit down.
Okay, I'm back, and I just want to assess your injection sites to make sure there is no reaction or anything. Is that okay?
Yeah, that's fine.
Okay, looking at your deltoid, the site is okay. There's no inflammation or any discharge. And then, is it okay if I expose your abdomen so that I can inspect the abdominal side?
Yeah.
I'm gonna do that. Accessing the injection site. Right, there's no inflammation, the injection site is clean, and there's no discharge. Alright, Sam, since we are doing pretty good right now, do you need anything else?
No, I'm good.
Alright, so here's your call line. I'll be back to reassess you, but in case you need anything, please make sure you press the call line. Is that okay?
Yeah, that's okay.
Alright, Sam. So Okay, document. Draw back my privacy curtain, and that's it.
Okay.